Mayo Clinic is leading the way for treatments of the hip in the sense that you get a one-on-one relationship with a surgeon, but that being said, that surgeon is involved in a much broader expertise-based team, where if it's something that's rare, an outside provider might only see that once or twice. That being said, as a department, collectively, we've seen it many, many times. We would just look back at our hip arthroscopy experience, and to be able to lean on not a single surgeon or a single provider, but on the wisdom of an entire collective group that talks, that is able to coordinate patient care, I think that's a huge value for a clinic. Hip arthroscopy really took off in the past couple of decades. And because of that, the hip arthroscopy that's performed 10 years ago is completely different than what we have today. We're able to counsel patients on the available data, on the available biologics out there. And really, our expertise is highlighted by the fact that we have some of the only reviews that are published out there on the biologics in the hip. By being part of the evolving techniques, we can say that we perform a modern hip arthroscopy that is very different from what is being performed elsewhere. One can see that natural progression of it used to be a diagnostic treatment, then people had labral debridement, so they had palliative procedures or non-restorative procedures. Then we switched in the past 10 or so years into the era of labral repair, labral reconstruction. We've changed how we treat the capsule. We've changed how we dial in our resection of any bony bumps, CAM osteochondroplasty. And that just highlights the fact that while many of the providers have stayed the same, Mayo Clinic's surgical technique has evolved and really set some of the standards for the evolution of care of the hip. We have 2 ongoing FDA phase 1 clinical trials in terms of non-operative hip injections and knee injections and treatment. We are oftentimes the ones that are writing these grants and writing these trials to see what the future might hold. We've published multiple technique videos and completely changed the nature of hip surgery in the past 10 years, past 15 years. Comprehensive treatment of hip dysplasia, having a hip arthroscopy, and open surgical treatment of your hip dysplasia, which used to be 2 separate surgical procedures, 2 separate surgeons. We now do at the same time for patients that are selected for that. That's a unique aspect of our practice. Looking at our over 10-year outcomes data, it's a wealth of knowledge out there. And the important thing is that we share the knowledge with our patients, with our other providers, and are able to better inform them and also evaluate the incremental advances that we have in surgery and justify and support the ones that work and otherwise find areas of innovation for the ones that don't necessarily work that could be made better. We have ongoing research into how we are changing things. And while the data is early, it certainly suggests that we might actually see lower rates of progression in arthritis in overall populational level studies compared to patients that don't undergo treatment. Making a referral to Mayo Clinic for patient care for any physician is the right choice because we are well versed in the treatment of the usual, the common, but similarly the unusual, the uncommon becomes common at Mayo Clinic.